Okay, what's happening? So today I'm just jumping on basically to give a rundown and start my first post for my vlog. Basically what I'm doing is vlogging my journey from kind of like day one of post-op surgery all the way through up to potentially 6 months post-op. Bit of background, basically what's happened is I own a gym, do martial arts, specifically grappling is kind of like my main area. Was up a pair of ladders, fell off the ladders, landed on my feet, high impact, landed on my hip, and then for 2 years played with further injuries. In that period of time between falling off ladders up until basically today, it took 2 years to figure out what was going on. So after the fall I took 2 weeks off and then signed up basically to ADCC, decided I was going to compete. Took 2 weeks off after the injury, didn't think much of it, didn't really think that I was that injured, and then was squatting on a warm-up set, blew my floating rib out and my QL on my back. That took like 3-4 weeks to kind of settle down to the point I couldn't even like lift my daughter up, who was at the time was 2. Like I couldn't stabilise my spine. That started to settle down, and then I did the same injury again, deadlifting. So it was off to physio. Seen 3 separate physios. I seen, and again they're all very like highly respected physios. But you should always, especially in these situations, you should always look for second opinions. But all 3 kind of led me down the route of I could have a labral tear in my hip. The pain I was getting just wasn't getting better. I was just getting massaged. I was following quite strict rehab protocols, trying to strengthen up my glute. It was looking like I was just getting this weakness in my glute. But I could deadlift 200 kilo and I could squat 150, 160 for singles. So there was something off. And it wasn't until I seen Niall over at Callahan's in Ayr that he suggested maybe looking at an MRI as I could have a labral tear in the hip. It took almost 2 years for that to actually get diagnosed, just due to the waiting list of the NHS, and even with private they were more interested in making sure that I never had spinal stenosis, which is fair because obviously that comes with its own health issues like loss of bladder control and bodily functions, lower limb paralysis and numbness and stuff. So I could understand why the private were more concerned about that, and obviously looked at my knee. So it turned out like I had 3 slip discs in my lower lumbar, which can be common, but it looked like more high impact that had caused it, and it spread it over the one side just for the way I fell. My LCL in my left leg had blown out, but it's managed that before, and I had impact changes on my knee, so I've got arthritis, but again it can also be normal. But all of it was looking quite inflamed because again I continued to try and train for 2 years through this process. So it wasn't until eventually I took some time off and then I finally got my MRI results from the NHS. Got a contrast MRI, so they stuck dye in my hip and then obviously stuck me in an MRI, and that confirmed that I did actually have a labral tear. So we're back off to the private healthcare, and they are now going to do a full hip arthroscopy and repair the labrum. Best outcome is 2 weeks on crutches. If they also have to shave the head of the femur due to a cam deformity of just bony spurs or any other issues on the actual head of the femur, they'll just shave that off. That'll be a longer recovery, and that'll be 4 weeks in crutches, obviously just to let the bone form without any impact and calcification. So the whole point of the vlog is basically to look at novel ways or novel treatments that could improve recovery. So this is basically an experiment. I don't know how many people have done it. I don't know if anybody's ever vlogged any of this before, but I'm going to give it a go and we're going to see if there's any enhanced recovery. I'm not doing it for performance reasons. I'm doing it for recovery, wanting to recover faster and want to get back on the mats and in the gym quicker for my members and for my business and for my mental health, because I hate being off. As much as I would like a day off sometimes, it's actually harder for me to sit still than it is to be in there. So We're going to do a joint format of using the hyperbaric chamber along with specific compounds, mostly peptides, and I'm already on TRT, so that's already a protocol that I've got, but also utilising anything else that I may find along the way, any other therapy or treatments that I can use, because I can't get any like massages are off the table obviously, because it's going to be a lot of bruised tissue and damaged tissue that needs to remodel. So we are looking at a handful of peptides, all chosen based off of their affinity to promote recovery and cellular repair and stuff like that. So I'll run through what we've got. I'm not really going to talk about the dosages today. That all's going to come down to the individual preference, but I do have a protocol. I did actually use ChatGPT. Some people will probably frown upon it, but really it's like a meta-analysis in your hand basically, so just pull all relevant information and you can talk to it and whittle it down to exactly being specific on what you're looking for. So we've got, first off, just a big tub of bacterial static water. So this is what we're going to be using to reconstitute the powdered format of the peptide back into an injectable fluid. It's got a small amount of alcohol in it. This just keeps it sterile. You may find some peptides, if I ever use them, they might need a more acidic mixture, so there is stuff that you can buy, or a more alkaline mixture. So again, you need to make sure that you're looking at what needs what, and if you don't know, you'll know when you mix it, because it won't fully reconstitute back in. So again, we'll see what happens. I've used these before in the past, never to this extent, so let's run through what I'm looking at, or what I've got here. So I've got NAD. This has got loads of health benefits, but its main effects are on the mitochondria, so basically your body's batteries, like looking at cellular health, looking at how much your body produces and uses ATP. This can really help accelerate that, especially when we're looking at on the cellular level, and it's going to really boost the performance of the cells, should have a bigger impact on remodelling and promoting that recovery stage. So we'll be using this. It does say to use almost a whole bottle once a week. I'll maybe spread that out. I've got TB500 here. You've probably heard of this one. This is usually coupled with BPC 157, which I do also have. These are mainly in the limelight just now because they're in tablet format as well. So basically what these do is increase angiogenesis, so increase blood vessels or blood flow to injured areas, or can be. So usually these are injected close to the site, which I will be doing. It'll be injected close to my hip. It can help with, really specifically with tissues that don't get a lot of blood flow, like your connective tissues. We're looking at mainly your tendons and ligaments for that. So it's the same with this BPC 157, angiogenesis, increased blood supply or blood flow to an area of injury, specifically the site it's injected in generally, but it is also systemic. Helps reduce inflammation, helps reduce cytokine markers. Basically, everything that we're looking to do is just reduce the amount of inflammation over time. Not in the beginning. At the beginning, inflammation helps the remodelling phase. It helps pull everything where it needs to go. So that's why we kind of try to avoid non-steroidal anti-inflammatories. Like, they just absolutely blunt the recovery process. We do need that in there, but we want to manage it as well, especially if it becomes too systemic. So yeah, we're kind of going to be looking at ways to reduce that or manage it. And we've got another one that does that here, which is Violon. I think that's how it's pronounced. This is a new peptide. I've not really seen much about this, but prior to picking it up and trying to do research, it seems to be quite more popular in Russia. They utilise it for recovery. They utilise it for repairing tissue that's damaged. It should be good for post-op wound healing and better structures when I'm actually trying to, or when the skin's starting to heal back over. It does say it's quite good for at the dermal level, so basically the level of skin. So we're sticking it in. Hopefully that will help implement a better recovery process for the scarring. I've got MGF. This is mechanical growth factor. A lot of people use this because it's like a precursor to IGF-1, LR3, so it usually helps with muscle building and repair. I'm not bothered about anabolism. I'm not looking for, especially something like this. This isn't going to it's not going to be super efficient for building muscle. I'm already on TRT for general health and recovery, but if you think a peptide like this is going to increase massive amounts of anabolism, I think you're pissing in the wind basically. But these are like after sleep, after hydration, after nutrition. These are like the 1%, you know, like these are the ones that are going to stack up and help put things in your favour, but they're never going to be what you should be relying on for your recovery. So I just want to put that in there as well. We've got ipamorelin. This is a growth hormone secretagogue. Again, if you've not heard of these, you might know other ones that are a bit more popular, like MK677. That's a 24-hour, all-day active growth hormone secretagogue. I can't stomach it. I hate it. It's one of the worst compounds I've ever used. I've used it in the past. I actually used it for recovery and sleep and the reported muscle building effects. Didn't get any of that. I got a ridiculously high heart rate, a lot of water retention, and shit, just felt like shit. So I wouldn't, for me, I tell everybody just stay away from it. It's fucking junk. Like, some people can take it and be fine. I can't, and the more people that I've spoke to about it, the more they didn't even realise they were having side effects from it. They'd never heard of it. They were just blasting it. So, and they take 12.5 to even 25 milligrams of something as strong as that when the studies are looking at like 1 or even less than 1 milligram. It's mental. So this is 5 milligrams. It's a growth hormone secretagogue. What it does is it pulses your natural levels of stored growth hormone sitting in the pituitary and the hypothalamus. Take this, it's like, from what I've read in previous studies, it's anywhere up to half an hour pulse. You generally try not to eat in between that time just so that you don't cut off. Carbohydrates can blunt the effects, reportedly anyway, so try not to eat and just let it do its thing. You know if you're taking too much of this, because you'll get pins and needles and other stuff that you usually get related with too much growth hormone. So it does work. I've used it before. The good thing about ipamorelin compared to other growth hormone secretagogues like GHRP2 and 6 is it doesn't release too much cortisol or too many stress hormones. So as much as they are useful, as much as they are good for controlling inflammation, too much can just wreak havoc and cause more inflammation. So we're trying to bring everything down, and this one has minimal effects on cortisol. And has well better effects on sleep, and growth hormone obviously helps with recovery of soft tissues, specifically tendons and ligaments as well. So again, this will be injected close to the site, but it will be working systemically anyway. Everything works systemically. We're going to finish off on copper. So it's actually quite blue as well, which is cool, which is an actual colour. This is a peptide as well. This is obviously copper. It's got great healing and wound healing properties. It's got good inflammation properties as well, so it reduces a lot of inflammation. We'll be using this close to the site, mainly for, like I said, its ability to kind of like bolster and control the inflammation response. And like I said, this will be used with conjunction to a hyperbaric chamber therapy. So we'll be using that again to increase the rate at which these are absorbed into the cells and hopefully improve how fast they recover. This will be taking place at the recovery lounge in Paisley. They've been really, really good, like I said, throughout the whole process. They've kind of looked after me. It's local, great team. Alan and Dylan are good at what they do. They've got a whole, like I said, a whole host of just other stuff other than just massage. They've got shockwave and magnetic resonance, and they've got thin air, they've got pumps, they've got the hyperbaric chamber, so they've got a lot going on. Just like I said, I'll be limited to what I can and can't use for the first at least 12 to kind of 16 week period. It'll be the most less invasive form of treatments. I'll be using a hyperbaric chamber probably up to about 3 times a week. We'll be doing anywhere between 60 to 90 minutes in the hyperbaric chamber. Again, its main functions hooked up to oxygen, so you're getting more oxygen in the body, more oxygen in the cells, higher cell diffusion and permeation. and you're doing that under atmospheric pressure. So again, the pressure within that chamber is heightened, so that again it forces more air, more oxygen through those cells. So we're going to implement both the peptides and the hyperbaric chamber, and we're going to see how quick or how fast, if there is any change in recovery. Like I said, I already use TRT, so my TRT protocol is anywhere between 150 and 300 milligrams per week. I cycle that just depending on how I feel or what I've got going on in terms of training. So if I've got quite a lot of volume in a high stress period of time, like in my work, it could be like remodelling the gym or something that requires a lot of heavy manual labour, I'll usually up my dose for a while, and I'll run that for a while, and then I'll back off again just down to like 150, and that's just when I'm kind of like less active and more focused on other things. So I also use edibles, THC edibles, so I use them for pain management. Been using them for the last 6 months. Doctors wouldn't give me anything for the pain, like can't use naproxen, or I'm not really supposed to have non-steroidal anti-inflammatories just because of I've got stomach issues, so ulcers and stuff, so they took that out. In fact, they didn't even offer me, and I don't want to take opiates, like because highly addictive, but they also become really ineffective. So the last thing I really want to do is take painkillers and either get hooked on them or dependent, and find out that when I need them post surgery, that the dose that they give me doesn't work. Like taking 2 ferries doesn't even tickle my tonsils these days, So in terms of pain relief, I've been using edibles. They're not designed for that, obviously, but the indirect treatment really helps. Like helps with my sleep, helps with recovery, and helps with disassociation for the pain, because I'm just thinking about the process of getting better, basically. So yeah, this is video 1 of maybe a few videos. I'll be checking in for the surgery on the 19th, and then we will be starting the process straight from the 19th. So once the surgery's done, I'll be going right into the protocol that I've got. I use ChatGPT to, like I said, to formulate my plan, including the HBOT, which is the hyperbaric chamber, and we'll be getting right into that post-surgery. So I'll use peptides for the first couple of weeks, and if I can get into the hyperbaric chamber, I don't know if I will be able to get into it, because travelling and my hip and trying to lie down in a wee tent might be a bit difficult with the pain. If not, it'll be post 2 weeks, and then we'll start running that and seeing how that helps as well. But yeah, if you want to follow my journey, if you like what's happening, or if you want to know more about it, just give us a like, give us a follow, and I'll upload the next one ASAP. Any comments, anything else you want to know, feel free to drop us a message. Like, I'm quite an open person. A lot of people lie about all this stuff. They don't know what to talk about. Use of steroids, or the use of peptides, or the use of anything. Everybody wants to claim they're natty, which I'm definitely not. I'm too old. I'm 35. I've got 5 kids, a business, and I want to train forever, forever until I'm 40 pieces, which apparently has already happened just now. So yeah, next video will probably be as I'm getting in for surgery, maybe post surgery, once I'm not with my tits on morphine, and then it will be then the next video will probably be the use of the peptides, and the protocol itself will probably follow, and how much I'll be taking and when, and how it's structured. I will put a copy of that on the page for people, and by the way, I'm not advocating that anybody use or does any of this stuff. Just a disclaimer as well, the Recovery Lounge haven't asked me to take any peptides. I'm just literally thankful for everything that they've done, and I thought that I would vlog my journey with the use of the peptides, and everything that they've done for me so far, and everything they're going to continue to do for me. So yeah, give me a wee like, subscribe to the page if you want to know more. At least that way when I post, you'll get notifications if you turn them on. And yeah, if any questions, man, just drop me a wee message. I'll be as transparent and as open as possible. I never ever have anything to hide. So yeah, I'll see you in the next one.